Good afternoon and welcome to this week's National Bleeding Disorders Foundation Wednesday webinar. My name is Fiona Robinson and I am the series host. The title of today's webinar is HEMA Biologics Treatment Option for the Hemophilia Community. We'd like to extend a special thank you today to HEMA Biologics, whose support made this webinar possible. This webinar is being recorded and the recording will be available shortly after it ends on the NBDF website bleeding.org. We encourage you to ask any questions you may have today. You can ask your questions by using the Zoom Q&A feature at the bottom of your screen at any time during the webinar. We will monitor your questions, and then following our speaker's presentation, we will put your questions to them. Unfortunately, for technical reasons, we will have to end the restream to LinkedIn, Facebook, and YouTube just before the Q&A session. So if you want to be part of that live Q&A, please do make sure that you are joining us today via the Zoom platform. Today, we are joined by Dr. Tami Singleton, who is the Chief Science Officer at the American Thrombosis and Hemostasis Network, or ATHN, and a hematologist and the co-director at the Ochsner Center for Hemostasis and Thrombosis in New Orleans, Louisiana. I'd like to thank Dr. Singleton for joining us today, and I will pass things over to her now to get us started.
All right. Well, welcome everybody. I hope that you are having a fantastic Wednesday. We're not going to refer to it as Hump Day. We're going to just refer to it as Fantastic Wednesday. How about that? It is my pleasure to have an opportunity to chat with you today to talk a little bit about a third option in our community in terms of treating breakthrough bleeding episodes as they occur in patients that are living with inhibitors. We're going to talk about 7-FACT. 7-FACT is a recombinant coagulation factor 7A, activated factor 7A, also known as epticog beta. I like the theme here, make the move, a smart choice in controlling bleeding. And so let's just go ahead and dive in and talk a little bit about some of the details associated with epticog beta, also known as 7-FACT. Again, I'm Tami Singleton. It is a pleasure to be here with all of you guys. I absolutely love to have an opportunity to chat and talk about educational topics within our community. And so what are we going to talk about today? We're going to talk a little bit about inhibitors and some of the things that we all know, just to remind us about the concerns that we still have in the hemophilia community about inhibitors. We'll talk about what is 7-FACT, also known as epticog beta. We'll talk about how 7-FACT was studied. We'll review some of the results of the PERCEPT-1 clinical trial in terms of a focus on safety and efficacy. And then if you have any questions about why should you consider 7-FACT and what patient support programs are out there and how do you learn more about 7-FACT. I think it's also really important in terms of a disclaimer that you know that I am providing educational information today. I am absolutely not providing any medical advice, and always the best place for you to go to have a conversation about what's appropriate for you as a patient, as a loved one supporting someone living in the community with hemophilia would be to have a conversation with your hematologist, with your provider at your HTC, because that's where that sacred relationship is, and that's where everyone knows everything about you. But today, you're going to learn some information about what we're going to talk about today, and you certainly may have some questions that you can then take to your provider if you think any of this is something that you want to talk a little bit further about. So again, we're going to dive in and talk a little bit about what is still a significant challenge in the community, and that's living with hemophilia A or B with inhibitors. So we all know that inhibitors are antibodies, and your body makes antibodies against factor replacement therapy. So in hemophilia, the antibody, the high affinity IgG alloantibody, is made in response to the exogenous factor product that's put in. So the factor replacement therapy ultimately binding to that exogenous factor that is infused in, rendering the factor product ineffective. So the resistance to factor replacement, as we measure it in the laboratory, is measured in Bethesda units. So you can see an example here of the sort of dividing line that we have with measuring inhibitors in terms of the blood test Bethesda unit. So if it's less than 5 Bethesda units, we typically refer to that as a low titer inhibitor. Your body has a response against the factor replacement therapy likely requiring a higher dose of a factor 8 or factor 9 product to then have a response, right? In terms of its effectiveness. So you can still use factor replacement therapy when you have a low titer inhibitor, less than 5 Bethesda units, but certainly higher doses will typically be required. If an inhibitor is measured and is greater than 5 Bethesda units, that's the dividing line. We call that a high titer inhibitor. Your body has a strong response against factor replacement therapy. And when that happens, a bypassing agent like epticog beta, like 7-FACT, is typically going to be needed, again, instead of factor replacement with factor 8 or factor 9. For us in our community, inhibitors are still considered the most feared complication in hemophilia. And again, I just want to put in context. Why are we having this conversation today? We're having this conversation today because it's important that we understand the options that are available in terms of treating breakthrough bleeding episodes that can occur in patients that are living with hemophilia A or B with inhibitors. That especially those patients that require bypassing agents, like we were talking about the patients that have high titer inhibitors, knowing in our community that prior to 7-FACT being available, we had recombinant factor 7A in terms of epticog alpha, Novo-7 RT being available, the plasma-derived APCC, also known as FIBA, and now today we're talking, of course, about 7-FACT, epticog beta, that is used for patients living with hemophilia A or B with inhibitors, and it is approved for patients having breakthrough bleeding episodes that are 12 years of age and older, again, living with hemophilia A or B. And we'll talk a little bit about that in just a second with inhibitors. So who might develop an inhibitor? Inhibitors can occur at any time, but often occur typically within the first 50 exposure days in terms of exposure to clotting factor concentrates. Now, there are some things that we know about inhibitor development, and certainly our research suggests that the probability of an individual with hemophilia developing an inhibitor is roughly about 20 to 25%, depending on what our source is for hemophilia A, and roughly about 3 to 5% for those patients living with hemophilia B. Now, who are the folks living with hemophilia? They have an increased risk of inhibitor development. Again, there are some things that we know. So one is, we know that patients who are living with severe hemophilia have an increased risk. If you are Black or Hispanic, there is an increased risk of inhibitor development, and there are various theories as to why that is. There's a lot of research that is still ongoing to really determine exactly why that happens. If you have a family member who is living with inhibitors, with hemophilia with inhibitors, so a family history would be significant. And then we know that certain genetic mutations within hemophilia are also associated with a higher risk of inhibitor development. Now, in addition to us recognizing that inhibitor development is still the most feared complication in hemophilia, we also need to recognize that we really have unmet needs that exist with on-demand bleed treatment in people that are living with inhibitors. So we have advancements in prophylaxis in terms of that modality of treatment, and it has certainly reduced the annualized bleeding rate, meaning how often you may have a bleeding episode, but breakthrough bleeding still occurs even with people that are using therapies for prophylaxis. And there are certain issues that are still associated with that. So when you're living with inhibitors, and if you are on prophylaxis, you may still require treatment that may take or need to cover a day or days to resolve. A breakthrough bleeding episode can also require multiple infusions to resolve, and rebleeds are pretty common. Now, the early treatment of bleeding episodes is especially important for people living with hemophilia, because we certainly have an understanding that the longer the wait, the more severe a bleeding episode may become. And we also know that with prophylaxis and having a treatment plan for breakthrough bleeding is incredibly important, to talk to your provider about specifically what you need to do and how you need to manage those bleeds. But typically, the longer the wait, the more severe a bleed can become. But always talk to your provider about your specific plan. And certainly, treating quickly can reduce the chance of potential side effects such as joint pain and joint swelling. But again, always make sure that you refer to your treatment plan with your provider. And additional doses may be required, especially if you have hemophilia and you have hemophilia with inhibitors that can lead to higher costs, more complications. And so just let's think about this for a second. Are you experiencing treatment outcomes when we talk about treating breakthrough bleeds that you notice may represent a disparity in comparison to patients, loved ones, or folks in the community that are living without inhibitors? So your peers, your family members that are not living with inhibitors. Do you notice like a difference in terms of treatment options if there's a breakthrough bleeding episode that occurs? And then just here as an illustration, here to the right, you have an unaffected joint, there to the left, and a joint that is affected in terms of hemophilia, where there's like a chronic target joint sort of setup where you have that very inflamed joint space with a damaged lining of the joint, cartilage degeneration, ultimately having an impact on bones and bone cells that can be destroyed, inflammation and hyperplasia, like the tissues surrounding the joint become very thickened. And then, of course, all of this is set up when there's blood that has escaped into the joint space and providing that one big cycle. So when we think about that, is there a difference when you're living with inhibitors in treating these types of episodes, preventing this setup from happening by having good treatment options for breakthrough bleeding in comparison to your counterparts who are not living with inhibitors? Again, so this is a focus. When we talk about disparities, we are talking about really health equity, meaning does the outcome look the same or equal when you look at two groups of people who are living with a condition? So with this, we have unmet needs that exist with bleeding episodes that occur. If you're on prophylaxis, you can still have bleeding episodes that occur and require treatment. And if you're not on prophylaxis and living with inhibitors and you're having bleeding episodes, we still need treatment that can really address this difference in terms of the response to therapy. So treatment outcomes, that's what we're talking about here, in terms of a disparity that exists between the inhibitor and the non-inhibitor community. So we know that factor 8 and factor 9 patients normally resolve about 80% of bleeds with one infusion. Now that's folks who are living without inhibitors. So that sort of presents a lack of things being equal, right? A lack of health equity, and the scale there kind of represents like this burden between communities. So the difficulties that come up with treating and resolving a bleed can certainly tip the scales of burden in terms of that health equity if you are a person living with inhibitors. So I just want to take a second to really walk through that concept, right? Because when we talk about health equity, what are we really talking about? And why is it important that we really continue to have additional therapies to treat breakthrough bleeding episodes like eptiCog beta, also known as 7-FACT, because we really want to have an opportunity to address this issue. I don't want this to be in the way. Let's see if I can move that. There you go. Okay, sorry about that. So are you experiencing treatment outcome disparity, a difference in comparison to your non-inhibitor peers? Again, just food for thought. Is your loved one experiencing treatment outcome disparity in comparison to his or her non-inhibitor peers? Is your child, right? So just think about that for a second. Some food for thought. The whole point of us talking about this. So now let's talk a little bit more about 7-FACT. So recombinant factor 7A, also known as eptiCog beta. And the indications and usage, again, this is a recombinant factor 7A that is indicated for the treatment and control of bleeding episodes as they occur in adults and adolescents. So if you're 12 years of age and older living with hemophilia A or B with inhibitors, this is a product for you. This is not indicated for the treatment of patients with congenital factor VII deficiency. And as always, there are a few things from a safety standpoint that we need to be aware of. So there are some warnings, including warnings about thrombosis. So because we're talking about a bypassing agent, because we're talking about treatment within the hemophilia community, we always need to have a heightened sense of awareness in terms of some of the things that can happen, including thrombosis. So we certainly know that serious arterial and venous thrombotic events may occur following the administration of 7-FACT. Please make sure that if this is determined between you and your provider that this therapy is appropriate for you, that you discuss the risks and explain the signs and symptoms. As a provider, you should have an opportunity to talk to your provider about the signs and symptoms of thrombosis, thrombotic events, blood clots, DVT as a patient, because as you receive 7-FACT, that's possible. As a patient, you will be monitored for signs or symptoms or activation of the coagulation system for thrombosis. And if you think any of that is occurring, you absolutely need to make sure that you alert your provider right away. So just some things to be aware of. Now, how does 7-FACT work? So a few things to consider. So 7-FACT is a recombinant factor 7A. 7-FACT, known as eptoCog beta, recombinant factor 7A works quickly at the site of bleeding, so you can sort of move on with life. So how does it work in your body? Well, this is an example of a blood vessel sort of cut in half. So we're looking into the blood vessel, and we're seeing that break in the endothelium, the lining of the blood vessel, being the site of a bleeding event. So 7-FACT certainly works and sort of activates and helps to activate coagulation factors that are on the surface of the activated platelet. So just like other bypassing agents, 7-FACT as a recombinant factor 7A sort of bypasses the need for factor 8 or factor 9 in that clotting cascade to ultimately have a thrombin burst and clot formation. It bypasses the need for that by helping to kind of force activate factor 10, ultimately leading to prothrombin generation, leading to this big thrombin burst that you see here that helps to really establish and solidify the fibrin clot that you see there with that thrombin burst. So you have thrombin burst, fibrinogen, ultimately with that nice seal with fibrin that's there. Now, what is something that's relatively unique about 7-FACT as eptoCog beta in comparison to eptoCog alpha is that eptoCog beta, especially in preclinical studies, was noted to have or designed to have a higher affinity for what's called the endothelial protein C receptor, EPCR. Again, it has a higher affinity and a really unique mechanism that makes 7-FACT, eptoCog beta, a little unique in terms of its mechanism of action. So just to take a second to explain, so you have procoagulants like factor 8, factor 9, factor 5, factor 10, factor 7. So those are the procoagulants. And you have your body's natural anticoagulation system. Well, protein C is one of those kind of natural anticoagulants. So when protein C binds to the endothelial protein C receptor, it really enables the sort of activation of that anticoagulation pathway. And when eptoCog beta as 7-FACT has this higher affinity for EPCR, this endothelial protein C receptor, it allows the additional sort of generation and support of the thrombin burst and ultimately to solid clot formation with fibrin really sealing that clot. So this is just like yet an additional pathway, an additional mechanism of action that is pretty unique to 7-FACT or eptoCog beta to facilitate the thrombin generation and burst, and clot formation. Just some food for thought and kind of interesting with that mechanism of action. So when we talk about 7-FACT, and as we get to a point now where we're going to dive into some of the safety and efficacy data from the clinical trial, we reviewed, or what's being reviewed here in the clinical trial program, this is a preview, that 7-FACT was evaluated to see if it was safe and effective in the treatment of patients with mild or moderate bleeding episodes. I'll talk to you a little bit here about severe bleeding episodes in a second, but what was determined to be successful treatment in the clinical trial program is if a bleed could be controlled at 12 hours was the primary aim and big focus, with no further increase in pain, and it did not require any additional treatment through a 24-hour period. So really that primary endpoint determining what happened was the bleed control at 12 hours. And then in total, what happened or were any additional treatments required through a 24-hour period. That was the definition of success. Now, in the clinical trial program, there were 27 participants, 465 bleeding episodes that were treated, and the age range was 12 to 54 years. Again, highlighting that epticoc beta 7-FACT is approved for patients that are 12 years of age and older living with hemophilia A or B with inhibitors. So let's take a look at those important terms. So remember I said the definition of satisfactory clinical response. So a bleed was rated as a satisfactory response if it was excellent or good in terms of the patient evaluation. So good meant that the symptoms of bleeding, swelling, tenderness, decreased range of motion had largely been reduced by the initial treatment. Not completely disappeared, but the bleed itself improved enough to not require any more infusions of 7-FACT. That was good. Excellent meant full relief of the symptoms plus no additional treatment being required. Now, in order to be satisfactory, it had to be good or excellent in terms of the patient rating for that bleeding episode that occurred. Now, what is also unique about 7-FACT? So there is something called an initial dose regimen. So the first dose of 7-FACT that would be used for any breakthrough bleeding episode, we refer to that as an IDR, this initial dose regimen. And the dosing schedule that is used as we're talking about these mild or moderate bleeding episodes was 75 micrograms per kilo, so 75 or 225. And each of those referring to micrograms per kilo. So that initial dosing regimen for mild or moderate bleeding episodes, the first dose, 75 or 225 as micrograms per kilo. And then one dosing regimen was used for severe bleeding episodes. And I'll talk to you a little bit more about that severe bleeding episode data here in just a second. So we're going to talk first about the clinical trial data and who participated in the study. So I mentioned 27 patients. There were 25 patients living with hemophilia A, 2 patients with Hem B. In terms of severity, most patients were severe, 25 of them. 2 patients had moderately severe hemophilia. And so again, severe hemophilia 25, moderate hemophilia 2, Hem A 25, Hem B 2. The factor level mean, you can see there 0.36, kind of roughly there, about just over 3%. And the inhibitor status, most patients were high titer patients, but there were 11 patients that were lower titer patients. And then there were 2 patients that were technically low titer patients, but they were completely refractory to increased factor dosing and thus needed a bypassing agent to have control over bleeding episodes. So that's how they were able to participate in the study. Now, we are now focusing on the regimen that was used in the treatment protocol, focusing on mild to moderate bleeding episodes. The top line, that burgundy line, represents what would be the treatment protocol starting with the 75. So you start off with 75 as the dosing regimen, and then if an additional treatment was required, that dose could be repeated at the 3-hour time point, and then every 3 hours thereafter, if any additional dosing would be needed. That's what you use as a treatment protocol or treatment regimen if you're using 75. Now, if you're starting with that initial dose regimen of 225 in a mild or moderate bleeding episode, if another dose was required, it would not be given until the 9-hour point. And then that subsequent dose would then be reduced to 75 micrograms per kilogram. So again, 75, if you start off with that, it can be repeated every 3 hours until hemostasis is achieved. If you start with 225 as a moderate or mild bleeding episode, then if there's another dose that's needed, you can redose at the 9-hour time point with 75 micrograms per kilogram. Again, so this is an example of the study treatment protocol for mild or moderate bleeding episodes. Now, what occurred during the course of the clinical trial program? So as we look at this, kind of proven to work across a range of inhibitor bleeds, there were knee bleeds, elbow bleeds, ankle, foot bleeds, shoulder, wrist, hand, and hip bleeds, really encompassing all joints. There were soft tissue or muscle bleeding episodes that occurred with the patients that participated in the clinical program, nose, mouth, soft tissue, muscle. And what's important to note was that 84% of bleeds that were treated with the 225 were treated with just one dose. An example of one dose helping to treat a bleeding episode so that you can kind of move on with some predictability, not needing additional dosing, just some food for thought. Now, in terms of a deeper dive with the efficacy with the results of the clinical trial program, this is a focus on that initial dosing regimen of 75 micrograms per kilogram, allowing for the control of mild to moderate bleeding episodes. And what was noted here, let's focus first on that primary endpoint, right? That 12-hour point. So what was noted here was that 82% of bleeding episodes responded successfully at that 12-hour time point. But what was also noted or observed during that point, during the clinical trial program, was that there was single dose efficacy at the 3-hour point in 29% of the patients that participated, and 96.7% of the bleeding episodes treated with 7-FACT at the 75 initial dose regimen resolved at 24 hours. Okay, so 96.7% of those. So this is a focus on starting with that 75 as an initial dose regimen. Now, there was an option with mild to moderate bleeding episodes to also treat with an initial dose of 225. With the 225, what you can see here is that at 12 hours, I'm going to focus on that first because that was that big question. 91% of those bleeding episodes were resolved, but what we see as an observation was that there was single dose efficacy with 84% of the bleeding episodes at 9 hours with the 225. Again, 84% was also observed at 3 hours, but 7-FACT 225 is at initial dose at 9 hours. There was single dose efficacy. Need a little more caffeine today. 99.5 at 24 hours to kind of complete that whole observation period. Now to further break it down again, kind of comparing again in a different way, the 75 to the right there in that sort of burgundy maroon color, starting at that 75, 252 bleeding episodes, the hemostatic effect at 24 hours, 96.7% resolution of bleeding, or success in terms of good or excellent rated by the patient. 213 bleeding episodes using the 225, 99.5% hemostatic effect successfully treated at this 24-hour period. And there was only one rebleed overall, a single rebleeding event in the 465 bleeds that occurred. So just 0.2%. This is another way of looking at it. A very low rebleed rate of 0.2%. Again, when you look at the 447 bleeding episodes, there was only one that had a recurrence or like a rebleed that needed to be addressed. And so again, we're focusing on mild to moderate bleeding episodes with 7-FACT at 75 or 225 as that initial dosing regimen. Again, 465 of the mild to moderate bleeding episodes treated with 7-FACT. And this is data looking at what occurred in that 24-hour period. Now, in terms of severe bleeding episodes, so we were before talking about mild to moderate bleeding episodes. In terms of severe bleeding episodes, what do we mean by severe bleeding episodes? So something that is potentially life or limb threatening, something that could produce severe blood loss or pain or causing or could result in permanent nerve damage. And of course, something that is an intracranial bleed of any type: epidural, subarachnoid, subdural, intracranial hemorrhage, interventricular hemorrhage. And you can see examples of that noted there. So these are all examples of severe bleeding episodes. Now, with severe bleeding episodes, there was one initial dose regimen that was used during the course of the clinical trial, and that's 225. And when there's a severe bleeding episode, that can then be redosed at 6 hours with that reduced dose down to 75. There were 3 severe bleeding events that were treated, and they're noted there: a traumatic intramuscular bleed, a spontaneous renal hemorrhage, and then a spontaneous hip bleed. All of the severe bleeding episodes that were treated with the 225 achieved hemostasis at 12 hours and did not require additional treatment. So in terms of important safety information, so we reviewed just a few moments ago in total the efficacy, breaking it down in terms of mild and moderate bleeding episodes using the initial dosing regimens of 75 and 225. And then we took a look at the severe bleeding episodes that occurred and the efficacy that was noted during the course of the clinical trial. Important safety information that is to note from the clinical trial program. Remember, the most severe possible side effect is abnormal clotting that could occur. You should know the signs of abnormal clotting if you're going to use 7-FACT and seek medical help immediately if they occur. That does include new onset swelling or pain in limbs, so legs or arms, new onset chest pain, shortness of breath, a loss in sensation or motor power, and of course, any alterations in consciousness or speech. Again, what is 7-FACT? It's an injectable recombinant factor 7A used to control bleeding episodes that occur in patients that are 12 years of age and older living with hemophilia A or B with inhibitors. Now, this is an injectable medicine, and you certainly need to know how to inject this so you can use this after you receive education and training from your provider or your HTC, who should not use 7-FACT, epticog beta, recombinant factor 7A. You should not use 7-FACT if you are allergic to any components of 7-FACT, if you're allergic to rabbits, if you have any known allergies, again, to 7-FACT or any of its components. Seek immediate medical attention if you have hives, itching, rash, difficulty breathing, coughing, wheezing, swelling around mouth, throat, tightness of chest, dizziness, fainting, low blood pressure. So any of those things, all of those things, or a few of those things, if you experience any of that, make sure that you talk to your healthcare provider right away. And make sure that prior to starting 7-FACT, if this is determined that this is right for you, that you have a conversation about your medical history and if you've experienced any significant problems in the past using a bypassing agent. Now, what should you also tell your healthcare provider? Everything, right? But make sure you tell your healthcare provider if you're pregnant, nursing, planning to become pregnant, if you've had a previous history of clots. You want to make sure that you reveal all of your medical history, any medications that you're taking, those prescribed, those are that are not prescribed, any supplements, anything over the counter, any surgery. So you want to have a good, thorough medical history and historical conversation with your provider before starting 7-FACT. And then we reviewed the possible side effects that could occur, but the most common adverse reactions seen with 7-FACT during the course of the clinical trial program included headache, dizziness, infusion site discomfort, infusion site hematomas, and infusion site reactions and fever. Now, if you feel that you are having an adverse reaction, always make sure that you notify your provider so that this can be documented in your record. But you can also, in addition to contacting your provider, you can also contact the FDA on your own anytime you feel like it. You can also contact HEMA Biologics, but the most appropriate place is to immediately seek medical attention, of course, to make sure that your provider knows. But if you want to contact the FDA directly or HEMA Biologics, the information and website and phone numbers are noted here. So 7-Fact is manufactured with quality in mind. So high quality, high purity for safety and peace of mind. So 7-Fact, remember, is a recombinant treatment for inhibitors and is not necessarily derived or is not derived directly from human blood. It goes through an extensive purification process that involves several steps. One is viral inactivation. It also involves something called affinity gel chromatography, and that's a process that separates the product from any unneeded or unnecessary materials. It also goes through something called, in chemistry, an affinity eluate process, where the process washes away any unneeded material. So there's a separation process of any unneeded material, then there's the washing away of any unneeded material, and then finally there's that sort of nanofiltration. It's a purification step that removes any remaining impurities that may exist in the product, really wanting to seal the deal in terms of purity for safety and peace of mind with 7-Fact. Now, we talked a little bit about safety, but just to highlight a few things, there were adverse events that occur in the clinical trial program, 42 of them in total. You can see the more common ones that I've already reviewed, including infusion site discomfort, bruising, dizziness, infusion site related reactions, headache, increased body temperature, or fever. Now, it's important to note in the 7-Fact clinical trial program, there were no neutralizing inhibitors or allergic reactions that were noted during the clinical trial program. And adverse event occurrences between 7-Fact 225 and 75 dosing regimens are all mentioned here. So there were no reported thrombotic or thrombosis events in the 7-Fact clinical trial program. Serious blood clots, however, have been reported with other or similar products, but none in the 7-Fact clinical trial program. So in terms of usage and convenience, 7-Fact can be infused IV in 2 minutes or less. We want to make sure that we're sensitive in terms of the timing. So 7-Fact can be infused up to 4 hours after reconstitution. It's pretty hot this summer, so we're all pretty sensitive to the fact that no refrigeration is required, but it does need to be kept between 36 and 86 degrees Fahrenheit. Should be protected from light, kept in the product package, and make sure that you don't freeze it. And remember, after reconstitution, it can still be maintained at that temperature between 36 and 86 degrees Fahrenheit for up to 4 hours. Don't freeze, don't store it in syringes, and no refrigeration is required as long as you can keep it between 36 and 86 degrees Fahrenheit. You know, sometimes, especially in New Orleans nowadays, we're not 86 degrees Fahrenheit. So you may, have to keep that in mind. Now, in terms of 7-Fact offering fewer total infusions. This is a way of looking at this. So what you have represented here is Novo 7 room temperature at 90 micrograms per kilogram compared to 7-Fact with that initial dosing regimen of 225. Now, in a 24-hour period, 7-Fact may offer fewer total infusions. So remember, if you start with that 225, then for a mild to moderate bleeding episode, you wouldn't dose again until 9 hours at the 75 microgram per kilogram dose, right? So start at 225, then redose 9 hours later if needed at the 75 dosing. But in that time, with the 90 micrograms per kilo of Novo 7 room temperature or Epticog Alpha, you would have used 1, 2, 3, 4 additional doses during that time frame. And then if you're using the 225 of 7-Fact, if you need additional dosing after that 9-hour dosing, then it would be every three hours, again, offering the possibility of fewer total infusions. Now, this is a couple of ways of looking at this. So if we break this down, if you take a look at the left, the number of infusions, if a bleed was controlled at the 12-hour time point, it would have required 90 micrograms per kilogram of Novo 7 per dose, 6 doses of that, in comparison to if you're using the 225 of 7-Fact, 2 doses. If it's controlled at that 12-hour point. And if we're talking about 24 hours, Novo 7 room temperature or RT, 90 micrograms per kilogram per dose, it could have been, you would have required or could have required up to 12 doses. pardon me, whereas with 7-FACT, if additional dosing was required with the 225, it would have required up to 6 doses. So these are kind of hypotheticals or possibilities in terms of what would happen comparing epticog alpha, which is Novo 7, to epticog beta, which is what we're talking about as 7-FACT. So in terms of how is it supplied, there's a kit that's provided to you to help with the mixing process. You have the vial, the pre-filled reconstitution syringe, the vial adapter, and of course instructions. The pharmacy will typically provide you with a syringe and other infusion supplies, and it currently comes in 3 single-use vials, a 1 milligram, a 2 milligram, and a 5 milligram vial. So reasons to consider 7-FACT. So we've talked a lot about 7-FACT this afternoon. If you have any questions, remember, always go to your provider to determine if something is appropriate for you. But we have rapid action with 7-FACT. 84% of those mild to moderate bleeding episodes were controlled with a single 225 dose, and that was seen primarily at that 3-hour time point. So very rapid action. In terms of efficacy, if we break it down into 12 hours and 24 hours, 91% efficacy for the 225s, 82% efficacy at the 75 at that 12-hour time point at 24 hours, 99.5% efficacy in terms of hemostasis, 96.7 for the 75 microgram per kilogram dosing as that initial dosing regimen. And that's, again, looking at those bleeding episodes in terms of those mild to moderate bleeding episodes. In terms of safety, remember that we have no thrombotic events, no neutralizing antibodies, and no treatment-related serious adverse events were noted during the course of the clinical trial program for 7-FACT. And then there's that 84% mild to moderate bleed control as single dose efficacy at the 9-hour time point if you're starting off with that 225 dosing. And then there are desirable effects. So demonstrated a low rebleed rate. Remember, we had that one bleed in the 448 that occurred, and then certainly may offer the possibility of having fewer total infusions if a bleeding episode were to occur. And remember, this product is approved for patients living with hemophilia A or B with inhibitors if you're 12 years of age and older. Now, just one last thing, if you are on Hemlibra for prophylaxis and you're a patient and you're 12 years of age and older living with hemophilia A, using Hemlibra as prophylaxis, there is currently a MASEC guideline. The Medical and Scientific Advisory Council of the National Hemophilia Foundation supports the use of 7-FACT at 75 micrograms per kilogram per dose for the treatment of breakthrough bleeding events for patients that are living with hemophilia A with inhibitors and on Hemlibra prophylaxis. So could 7-FACT be an option for you? Remember, the first place to determine that is going to be between you and your provider, your hematologist, your HTC. But if you have additional questions, once you make that treatment decision between you and your provider, if you have additional questions, these are some things that you may want to think about. If you have an interest in knowing more after today, talk to your provider. Is this appropriate for me? How long does it take to get a bleed under control? Would that apply to me? How many doses? How often do you have to take something or get up in the middle of the night if you have a bleeding episode that is occurring? So questions that are specific to you, talk to your provider about that. And just some food for thought. Would it be an option for you? That's always going to be a question for your provider. Is it an option in terms of which dosing regimen would I use? You always have to have your unique plan in terms of bleeding events as they occur. And would this just be appropriate for me and my overall treatment regimen? If so, both to your Hemophilia Treatment Center and you, HEMA Biologics has a support program noted here. HEMA Biologics Cares. You can reach out to your representative. Talk to your HTC about options that are available for you. If 7-FACT is going to be something that's going to be included in your treatment regimen, there's copay assist programs, patient assistance programs, quick start, bridge program, benefits, prior authorization support, all of the things that HEMA Biologics can support. HEMA Biologics also provides connection with patient advocates if you have questions from a lived experience standpoint. You can connect with HEMA Biologics through their patient advocacy phone program, again, in conjunction with your conversation with your provider. And there's a QR code if you have any additional questions or just want to hear more information about the patient advocates that are available through HEMA Biologics. Again, where to learn more? First, always your HTC, your hemophilia provider, your hematologist. But then there's additional support. On the website, there are reconstitution videos. There's help about the programs I just mentioned, the patient advocacy hotline. If you have anything that you want to report, in addition to reporting it to your provider, that's a place you can do it. So I hope that I got all of that in an appropriate time, and I'm happy to take any questions if you have them.
Super. Thank you so much, Dr. Tami Singleton, for telling us
Absolutely.
all about 7 facts and how it can be used to help manage hemophilia with inhibitors. Just before we start the live Q&A, I want to draw our audience's attention to the chat. You should see a chat icon at the bottom of your screen, and you'll see there that I have put a link to the 7-fact PI, so you can go and check that out. And we've also put that into the comments on the LinkedIn and the Facebook and the YouTube as well. And I will just remind our audience that unfortunately, due to technical reasons, we do have to say goodbye to our Restream audience at this stage. If you want to join us for the live Q&A, please have a look at the comments in your platform, and you will see there's a link there that you can follow to come join us over here on Zoom. And do come back in 2 weeks on August 13, when we will have an update on some exciting research stemming from the My Life, Our Future project.